Hi, I'm here to talk about NeoLife, the future of infertility treatment powered by artificial intelligence. Let's take a look at the problems journey. 1 out of every 6 couples has infertility problems. 75% of infertile couples use ART, including IVF, ICSI, or IUI methods for infertility treatment. 50% of world ART cycles occur in Europe, 1.2 million cycles annually. However, success rate is very low. Successful pregnancies occur in only 25% of cycles. This means 3.5 billion euros annual wasteful spending on infertility treatment in Europe. Let's talk about the main infertility problems more. ART is the best treatment method, but also a complex and ambiguous one. This results in a failure rate of 55% of infertile couples discontinuing treatment without becoming pregnant. The first and foremost problem is hard decision making. Physicians and clinics don't have quantitative methods to clarify and explain the journey for couples. That makes it very difficult for them to make any decisions. Another issue is emotional costs. Ambiguities in time, duration, and result of the treatment makes 50% of couples experience depression, while 45% of them experience anxiety. The last but not the least problem that patients face is high financial risk and pressure. There is not exact prediction of the required number of cycles to get pregnant, while some couples might need multiple cycles, which imposes too much financial pressure on them. We at NeoLife have come up with a solution, pre-ART report powered by AI. Let's see how would NeoLife's solution work for 2 couples with different conditions. Suppose we have couple A, and the model has presented the following report. The report shows that they have a high chance of pregnancy using their own eggs and sperms. It indicates that their pregnancy chance is 81% in the first cycle, 96% in the second cycle, and almost 100% in the third cycle. The report also states that there has been a problem with the woman's cervical polyps and thus suggests the IUI method for treatment. For couples with this condition and having high chances of pregnancy, we are lowering the stress and increasing the hopefulness of patients. Knowing their chances, couples can plan a variety of financial programs for themselves. Now assume that we have couple B. The algorithm output shows that they have a low chance of getting pregnant using their own eggs. The report says that their pregnancy chances in the first 3 cycles are 15, 28, and 38% respectively. The model indicates that the woman's eggs have a problem and says that it's better to start the treatment with donated eggs and by using the ICSI method. In this scenario, our assistant helps the couple to double the pregnancy chance using egg donation. It also helped them in saving a lot of money by choosing the right treatment path, and finally there will be lower harmful effects on the woman's body. So far, we have talked about NeoLife's benefits for couples, but this AI assistant can also help infertility clinics to increase their success rate, insurance companies to understand the couple's risks better, and physicians to give better insights to their patients. We believe that the NeoLife report can be placed as a mandatory protocol in the treatment system in the same way as any other medical test. With NeoLife, the 3.5 billion euros invested unsuccessfully can be turned into a success by increasing the success rate of pregnancy in infertile couples by a multiple. We have 2 business models, NeoLife pre-ART reports and fertility warranty models. In the first model, we will sell our pre-ART reports to couples, physicians, infertility clinics, and insurance companies. In our second model, we warranty couples for 3 ART cycles. In this model, they can only pay the cost of 1.7 ART cycles and get 3 cycles instead. If they don't get pregnant, we will refund the 0.7 cycles cost, and thus they will be charged only for 1 cycle. Here we can suggest our warranty model to couples with high chances of pregnancy in the first 3 ART cycles that our AI model has estimated. Hence, it becomes a win-win game for both sides of the deal. Our business model also has advantages for clinics. Currently, among every 100 couples that use IVF, 44 pregnancies occur. We can improve this success rate by 46%, making it 64 successful pregnancies out of 100 cases. This success rate improvement can increase the number of clinics patients that use NeoLife's warranty model, increase the number of IVF's utilization, and finally increase the rate of new clinics patients who sign up for IVF treatment. The ART treatment has an extensive market in the world and Europe. The ART market value is estimated at 14 billion euros globally, which Europe owns 7 billion of this amount. The annual growth rate of this market is reported at 7.5%. Almost 50% of the costs are covered by governments and insurance companies. More than 1,340 ART clinics are active in Europe. We plan to cover our headquarters country market in the first phase, and then we are going to target the DACH countries and all European countries in the next phases. The NeoLife MVP model is trained on UK HFEA public dataset and predicts couples' pregnancy chances in the first 3 ART cycles. We trained an AI model with our first dataset and implemented it on a web application. This dataset includes quantitative data and binary features, which indicates whether they are reasons for infertility treatment or not. We have negotiated with some clinics around the world to collect datasets. We already signed contracts with 3 clinics in the MENA region and are negotiating with 3 more clinics in this area. We are also negotiating with 2 clinics in Europe through our partners and expect to gather 15,000 patient files. Currently, as mentioned, our prototype model is trained on the UK HFEA public dataset, containing 300,000 infertility patients' data. We will improve the prediction accuracy of NeoLife's initial product for market entry by collaborating with our partner infertility clinics and developing our artificial intelligence model using new types of datasets. Furthermore, in this product update, we aim to predict the exact ART cycle in which pregnancy will occur and the success rate of couples in case of using eggs, sperm, and embryo donation in addition to their own eggs and sperm. We expect our Type 2 dataset to have various new features such as parental clinical information, supplementary maternal information, maternal blood test, maternal ultrasound, and paternal SDF and SFA tests information. We estimate that we need 35,000 patients' ART treatment data and plan to gather this data and train our model to reach 80% ROC AUC. There are 2 serious competitors for us at this time. The first one is Univify, a USA-based company targeting the US and Canadian market. They have raised $6.7 million in 2 rounds so far and are working with 50 clinics around the US and Canada. The other competitor is called In Fertility. The company has founded in 2019 and gained $1 million grant plus an undisclosed amount of venture round raise. Unfortunately, there isn't enough data about their product yet. We have some product update plans also. We are planning to add other AI models to our AI assistant in order to improve the ART treatment success rate. So we plan to gather data and train AI models in these 3 categories. The first one is genomic similarity. The algorithm evaluates and analyzes the couples and donors' genomic data to calculate a similarity score between couple and donor. The second one is embryo selection. Our artificial intelligence model can determine the organism most likely to have a successful pregnancy by monitoring the growth of fetus in time-lapse images. And the third one is personalized medicine. There are several drugs used to treat infertility. Our AI model can offer the most effective medicine with the minimum side effects to the couple according to their clinical and medical conditions. We have gathered a team of the best and experienced AI engineers, data scientists, business developers, and managers. Alongside our team, we have 2 specialists as our advisors. Our medical advisor, Dr. Ziai, is a urologist and professor of urology at Shahid Beheshti University of Medical Science, which is one of the most acclaimed universities of Iran and Asia. Mohammad Alaga is our business consultant with more than 5 years of experience in Austria as a business consultant and entrepreneur. Our team has a great experience in machine learning and software development in health field. To be mentioned, Genodeep is a cancer screening system based on blood samples. AI COVID is a system for determining the risk of coronary diseases and predicting the coronary symptoms of each person in case of coronary infection. And fetal screening is a platform for determining fetal's Down syndrome before childbirth using the maternal blood samples. Thank you so much for watching this video. Goodbye.